I was talking to my neighbor Helen last week. Lovely woman, just turned 72, and she mentioned something that really stuck with me. She said, "I take 7 different pills every morning, but I don't feel any better. I just feel like a walking pharmacy." Now, if that sounds familiar, I want you to do something for me. Take a quick look at your medicine cabinet or pill organizer. Are there medications you've been taking for years without question? Maybe something your doctor prescribed way back when, and you just kept refilling it? Here's what most seniors don't realize. Some common medications that were perfectly safe for us in our 50s can become downright dangerous after 60. Today, I'm sharing 5 of these problematic pills, and more importantly, what you can take instead to stay healthy without the risks. Let's start with one you've probably seen advertised on TV. Medication number 1. Over-the-counter sleep aids, Diphenhydramine. That little blue pill you take to help you sleep, the one that's been around since your parents' generation? It might be doing more harm than good. Medications like Benadryl or Tylenol PM contain diphenhydramine, an ingredient that studies show can increase dementia risk by up to 54% with long-term use in seniors. Here's why it's particularly bad for us after 60. As we age, our bodies process medication slower. What gave you 8 hours of sleep at 50 might leave you groggy for 2 days at 70. Plus, it dries out your system, and I don't just mean cotton mouth. We're talking increased fall risk from dizziness, constipation that no prune juice can fix, and even blurred vision. So, what can you do instead? First, try tart cherry juice. It's packed with natural melatonin. Or, here's my personal favorite, mix half a teaspoon of raw honey in warm milk before bed. My wife swears by this old Amish remedy, and she sleeps like a baby at 75 inches. Medication number 2. Proton Pump Inhibitors, like Nexium or Prilosec. Now let's talk about those little purple pills for heartburn. If you've been popping them daily for years, listen closely. While they're great for short-term use, long-term PPI use is linked to some scary stuff in seniors. Vitamin B12 deficiency, which causes memory problems, increased bone fracture risk, and even kidney damage. Why? Because these medications don't just reduce stomach acid, they nearly eliminate it. And after 60, we need that acid to absorb nutrients and fight off infections. Here's a safer approach. Try chewing gum after meals. It neutralizes acid naturally. Or sip on aloe vera juice. For immediate relief, mix 1 teaspoon of baking soda in water, my grandfather's farm remedy that works better than any $30 pill. But here's the most important tip. If you've been on PPIs for more than 2 weeks, don't stop cold turkey. Work with your doctor to taper off slowly while introducing these natural alternatives. Now, before we get to our third medication, the one that secretly raises blood pressure in 60% of seniors, I want you to think about this. Helen, my neighbor? She worked with her doctor to eliminate 3 unnecessary medications last month. And guess what? Her brain fog lifted, her energy came back, and she's gardening again for the first time in years. That could be you. And when we come back, I'll reveal the common pain reliever that's aging your kidneys faster than time itself, and exactly what to ask your doctor about instead. Medication number 3. NSAIDs, like Ibuprofen or Naproxen. Pop 1 for a headache. Take 2 for back pain. Sound familiar? NSAIDs, think Advil, Aleve, even that trusty Aspirin, are like that friend who helps you move but scratches your hardwood floors. Short term? Fine. But long-term use after 60? Studies show it can damage your kidneys so slowly you won't notice until it's too late. Here's why it's sneaky. Your kidneys filter medications differently as you age. What once left your system in hours might linger for days now. And get this, research from Johns Hopkins found seniors using NSAIDs daily had a 20% higher risk of anemia. Why? Because these pills quietly irritate your stomach lining, leading to invisible blood loss over time. Try this instead. For joint pain, ginger tea works wonders. My Korean neighbor Mrs. Kim boils fresh slices with honey. For headaches, peppermint oil rubbed on the temples, my daughter's trick from her yoga instructor. And if you must take an NSAID, never exceed 7 days without talking to your doctor. See this golden root? A teaspoon of turmeric powder with black pepper twice a day reduces inflammation as effectively as ibuprofen for many seniors, without the gut damage. Just ask 78-year-old Bob from Phoenix who sent me this message last week. Medication number 4. Benzodiazepines, like Xanax or Valium. Now let's talk about the elephant in the room. Anxiety meds. Maybe your doctor prescribed them after your spouse passed, or during a stressful retirement transition. But here's the terrifying truth. The FDA warns that benzos increase fall risk by 50% in seniors, and just 3 months of use can cause memory problems mimicking dementia. Why? These medications don't just calm nerves, they slow everything. Your balance, your reaction time, even your breathing. And after 60, your body can't clear them as fast. That small dose from 5 years ago? It's accumulating in your system like invisible quicksand. Safer solutions. For sleep anxiety, try weighted blankets. My VA hospital volunteer friends swear by them. For daytime calm, lemon balm tea. It's what Italian grandmothers have used for centuries. And if you've been on benzos long term, please don't stop abruptly. Work with your doctor on a tapering plan. A viewer named Martha emailed me last month. I weaned off Xanax after 12 years using CBD oil and morning walks. At 81, I remember my grandkids' birthdays again. That's the power of safe alternatives. Smooth transition to final medication. Now, we've saved the most controversial for last. A medication so common, you've probably taken it this week. It's linked to cognitive decline, yet 4 in 10 seniors take it daily. When we come back, I'll reveal why this harmless pill accelerates brain aging. The exact phrase to say when your doctor tries to prescribe it, 3 kitchen cabinet swaps that work even better. But first, if you're realizing you or a loved one might be on one of these risky medications, take a breath. Knowledge is power. And in our final segment, we'll put all that power in your hands. Medication number 5. Statins, like Lipitor or Crestor. Let me be crystal clear. Statins save lives for high-risk heart patients. But here's what drug commercials don't tell you. For seniors over 70 with no history of heart attacks, the latest research shows the risks often outweigh benefits. Why? 3 scary reasons. They deplete CoQ10. That's the nutrient keeping your muscles strong, explaining why so many seniors on statins struggle with weakness. Studies link long-term use to fuzzy thinking. Some call statin brain. They may increase diabetes risk by up to 46% in women over 60. Now, before you consider stopping anything, here's exactly what to discuss with your doctor. Ask about your ASCVD risk score. If it's below 7.5%, research suggests lifestyle changes may work, as well as pills. And speaking of alternatives, this right here? Wild-caught salmon. Eating it twice weekly provides the same heart protection as low-dose statins for many seniors. Add some olive oil and garlic. My Greek friend Calliope's family has outlived their doctors for generations eating like this. The grand solution, your personal medication action plan. Over these 3 videos, we've covered 5 risky medications. If you're feeling overwhelmed, here's your simple 3-step plan. 1. The brown bag checkup. Literally put all your meds in a bag and take them to your next doctor visit. Ask 2 magic questions. Is this still necessary? And is this dose still right for my age? 2. The 3-week test. For appropriate medications, work with your doctor to safely taper off 1 drug at a time. Track how you feel in a notebook. Many seniors discover their side effects were actually medication effects. 3. The grandchild rule. Would you let your 8-year-old grandchild take this long term? If the answer makes you uncomfortable, it's worth a second opinion. Closing story and call to action. Let me leave you with Roy's story. At 79, he was on 9 medications, dizzy, depressed, barely leaving his recliner. After working with a pharmacist specializing in senior care, down to 4 essential meds. Last month, he sent me a photo from his Alaskan cruise, doing the cha-cha on deck. Your turn. If this series helped you, pay it forward. Share it with 3 friends. You might give them their own Roy story. Hit subscribe because next week, we're exposing the healthy vitamins that can actually harm seniors. Until then, remember, the best medication is often an empowered patient.